Your Excellencies at the podium, all other protocols observed. Well, some people were smiling because they know Joseph is not a protocol person, but when it's necessary, we have to follow the rules. I would like to say a big thank you to the technical committee that helped develop the purpose agenda for this meeting, and also the group that made this happen, the logistics, etc. I'm not going to mention names, we'll do that later during the week. But as you've heard from various speakers, the purpose of this meeting is to take stock of what has happened in the past 10 years when newborn was made a little bit more visible from the mother. Previously, we were told the newborn is part of safe motherhood. But 10 years ago, the baby and the mother were put together, and I'm sure that's what all mothers want. They want both themselves and their babies to be saved, and not only they being saved without their babies. We hope to hear a bit more about what has happened globally in the past 10 years, and also have countries share with us their successes in the past 10 years. But we're also asking, and I'm borrowing a word from a colleague who is not here, to shamelessly share their challenges, those that they've been able to address and those that they are still struggling with. We did ask for participants coming from countries to come as a team, deliberately, pulling from various partners who are working on newborn health. And the purpose is for countries that are not talking together with implementing partners to start so. Those who are already talking to implementing partners to strengthen their relationship and to coordinate. As we heard, and I don't remember who said it, one organization cannot do this work. Ministry of Health alone cannot do it. NGOs alone cannot do it. We all need to work together, but we need to coordinate our effort to make the funding that we have, to use it efficiently. So the primary purpose here is to listen, see what other countries are doing, what can other countries take from the lessons that are being shared, and what can they do to accelerate actions that they are already taking to achieve newborn health. The what, we'll be hearing again about what has happened globally. We'll be getting technical updates from our colleagues from WHO and other organizations. A number of guidelines relating to newborns have been given out in the last 5 years or so. We'll be hearing a bit more about it. And then the bulk of the agenda will focus on country sharing. And again, we want this to be participatory, so please feel free to ask questions. We don't want people just presenting. We want a discussion, a dialogue. We want to learn from this process. And then with all implementation, it's important to have solutions. Some of the solutions we already know, some we don't. So there's need to discuss what are some of the research questions that need to be answered. And WHO and SNL and other colleagues did carry out an activity, an exercise to find out what are the pertinent research questions. That will also be shared during this week. And you heard about the Global Action Plan. We hope from here, every country not only contribute to the draft Global Action Plan, but also take it as their rallying point to start or to catalyze action for the newborn at country level. So in general, this is what you'll be hearing. The key thing we want out of it, so that the funders, as well as the organizers of this meeting, will be happy, is that the meeting does not end here. When you go back to your country within a week or two, we want countries to get together with their partners and figure out what do we need to do based on what we heard from this conference. Thank you.